Hello, welcome to Live Feed with Columbus Medical Aesthetics. I'm Marie White, medical and laser practitioner. Today we'll be doing a treatment on Angie Hunt, nurse practitioner and owner, operator of Columbus Medical Aesthetics. This is one of Angie's favorite laser treatments we do here. The photofacial, as a lot of people know, photo rejuvenation. Also BBL, broadband light, is actually what the laser treatment will be today. We have numerous filters that we use per treatment. Each one serves a different purpose. One is for treatment of vascular, so for like facial veins. We also use one for hair reduction, acne, and also one for pigmented lesions, so for dark hyperpigmentation that we may get actually even from just sun tanning and all throughout the summertime. So today we'll be doing a treatment with Angie, and she's going to talk to you a little bit shortly as we get her prepped for her treatment. We look forward to any questions you may have regarding this procedure as well. Thank you.
Yeah, so the broadband light, Marie, you can start washing, is our laser. There's also IPL, or intermittent pulse laser. So you might have heard the two types of laser. They basically do the same thing. Broadband light has a wider spectrum, so it can cover more area. A laser uses a light as a photon to produce heat, and these different light sources go to different areas in the skin, and they're attracted to different structures in the skin using the light wavelengths, depending on how long or short the wavelength is. So those structures that it's attracted to are things like melanin, which causes hyperpigmentation, also hemoglobin, which is from broken capillaries, and what we call hemangiomas, the little red cherry angiomas. We can also target those. And so, you know, the BBL is not going to be any downtime. You're not going to see a whole lot of difference right away visually like we do with Botox and fillers. However, after 3 to 6 treatments, a series at first, you will see mostly that the skin tone is much more even. You don't have so much discoloration in the skin. And so it's more of an anti-aging procedure that we do. The other interesting thing about it is that a lot of practitioners, as well as seeing the cosmetic difference after a while, people that get, say, 3 to 4 a year, after a while there's a big difference between the treated skin and untreated skin. Also, they're also seeing a lot less pre-malignancy and cancerous lesions. So the actinic keratoses that you might see, and of course the melasma and stuff, you don't see those as you age if you do this in it just as part of your routine, your anti-aging yearly routine. So it's a real nice procedure, and most of you know that melanin is one of our hardest things to treat. Once you see the lesion, they're pretty deep. You know, you can do chemical peels, which can lighten some of it, but you know, doing a BBL, you know, if you're treating pigments, you'd want to do it in a series of 3 to 6, like I said initially, about one every other week. And then you'd want to do just treatments, say 3 to 4 treatments a year. The full face treatment usually runs here, it runs about $250. Like I said, there's no downtime. You feel a little tight, a little warm at first, not very painful, little pops, but they're real quick. And Marie's wonderful. She's done this for years, so she's quick too. Also, the other thing that we've treated, and dermatologists have sent people to us because of our laser, is rosacea. Rosacea, you know, there's no cure for rosacea. However, you can keep it under control by starting out and getting you a series of 3 to 6, and then doing it yearly, as we all should for our anti-aging anyway, but just keeping that redness under control. 3 to 6 or 3 to 4 treatments a year really helps rosacea, helps it be controlled. So we're really glad to hear any comments or questions from you guys. Marie's here 5 days a week to do some free consultation. You ready?
Yeah, so
All
we'll
right.
get started with the treatment.
All right, well, y'all stay tuned. In about a minute or two, we're going to go live with the treatment.